Don't miss the tail of elephant. To win a war, it is essential to understand your enemy. If you miss any trivial things of your enemy, you can lose because of it. Precise evaluation of your patient should be carefully performed as much as you can. You need to assess all the clinical data, including laboratory examination and imaging study. Imaging study of a patient is the most important map in finding the way to how to defeat your enemy. Therefore, we need to check whether any index lesion has the typical findings for specific malignant lesion on each imaging modality. If the findings on any imaging modality is not sufficient to diagnose, we need to carefully assess if there are any additional findings on other imaging modality that can support to diagnose a particular malignant tumor. If the findings of all imaging modalities are still not conclusive, we can closely follow up or perform percutaneous biopsy depending on the urgency of clinical conditions. When you assess the imaging study for hepatic lesion, one common pitfall is to miss additional tiny tumor, mostly in different segments, which is located at the far distal tip of the liver. This missing sometimes critically affects on the selection of the best treatment options. Because of this kind of missing, a patient might be ablated or even resected only for the main tumor, and additional, actually unnecessary if we didn't miss it at the planning phase. The treatment is inevitable later. Here is a good example. This patient has two HCC nodules in segment 4 and segment 1 tip. Unfortunately, we missed the S1 tiny lesion at the time of CT reporting. However, our surgeon detected the S1 tiny lesion during the operation and laparoscopically resected. Therefore, careful evaluation of each imaging modality should be performed at the whole area of liver without skipping any extremely peripheral part. Most common site for missing, I think, the far distal, far lateral tip of S2 or 3, far dome of S8 or S4, far distal tip of segment 6, deep S1, etc. Besides two peripheral locations, another common location is the perivascular tumor abutted to large vessel. We often consider it as a part of the large vessel. In addition, we should carefully assess if there are any extrahepatic metastases, including lymph nodes, adrenal gland, peritoneum, and basal lungs. To avoid this mistake, to assess DWI of MRI can be a useful tip not to miss any additional tiny lesion if liver MRI available. After fully picking up all hyperintense spots from DWI image, process of classification for each hyperintense spot should be followed with other imaging sequences, including dynamic T2 weighted image and hepatobiliary phase image one by one. In summary, careful evaluation of any imaging study in planning phase is very important for providing the best treatment option in patients with hepatic tumors. Please don't miss the tail of element. Thank you very much.